Good morning, this is Dr. Gargano. We are here with our wonderful patient that was very compliant. 2.5 months ago, we did a nose reconstruction. Patients had a complete obstruction of the right side of the nose for Mohs surgery and a bilobed flap that was done on the right side. So the nostril was retracted, she could not breathe from the right side, she had sleep apnea. Today's follow-up after a few months of stenting, very important in this kind of surgery. The patients gave us some comments on how she breathes and how she feels. Go ahead. How do you feel?
Oh, I feel much better. The left side, I think, was with a deviated septum, cleared up much more quickly, but I've never been able to breathe as well that I remember. So that was wonderful. And then the right side took longer because of the dropped cartilage in there, and I had a stent that he kept in there, and also I slept with it for the past 3 weeks. And I breathe much, much better than I have before. Good. On both sides.
That's good. Thank you, Nan. So what we did, essentially, technically speaking, we had to reconstruct the whole nose, taking the cartilage from the septum and from the left ear. As you can see, the left ear is completely healed. There are minimal scarring. We used that composite graft of skin and cartilage to give elongation of the nostril on the right side. We will show the right side in a second. You can see that from the right side, the nostril that was retracted, now it's almost at the same level of the other side. So we gain at least 5 millimeters in length. At the same time, the nostril was not supported. We put alar graft bilaterally, and you can see how supported it is on one side and the other side. This can be testified by breathing in and out forcefully. See, there is no collapse of the external valves. The inner valves, they are stable. You can do it also independently, and you can see how much support you have on one side and the other side. Then from below, you can see the septum is straight, and we can show inside the nose that has got a straight septum on both sides. So I have to thank the patient because she has been very compliant. Is the ideal patient to have, and I have to congratulate her on what she did with stenting and compliance and being always present for every follow-up, and especially for trusting me in this journey that it was a joint journey. And finally, I'm very happy to see her breathe and sleep fine. Although she saw the other day the sleep apnea doctor, and he did that. Her sleep apnea is completely solved. She can breathe. She's happy. Thank you so much.
Well, thank you. And I will add that you were there for me all the time. And you called me and I called you. And at one point I was coming to you every other day. And you were always willing to take me and help me. So that was very good.
Thank you to all the patients and to you.
Thank you, Dr. Gargano.
Thank you.